go. You can use the arrow.
Mary Liz has such suffering. Thank you for your courage in sharing this with this audience today. It's very touching to hear you speak in this way, and it is, you're right, it is such a mystery. By way of intro, I'll give you a little bit about our family's journey, and I'm on the other side of that. I'm a mom, and it was 5 years ago that our family was hit with our daughter's illness. We didn't really see it coming. She was hard to raise, but it really came to us full force. And this is a pretty accurate picture of what that felt like for us when her illness just came out. It's really impossible to convey to you the sense of hopelessness that as a family we felt when this all came crashing down on us. It was really profound sadness at the promise of somebody who was very talented, very bright, and who apparently at that moment, when we didn't know any better, appeared to be lost. There was an intense fear at the incredibly self-destructive, dangerous behaviors, the substance use, and hardest of all, really, for parents, was the chaos that we felt. The sense, oh, you can't hear me, sorry. The sense that that nothing made sense. The feeling that whatever we did was chaotic, it resulted in some chaotic behaviors, and that whatever we did resulted in things that were unexpected, more raging, less raging, and then, perhaps worst of all for a parent, the sense that perhaps we had something to do with it, except we didn't know why. So our daughter had suffered, perhaps in the way that was just described so touchingly, for about 2 years. And she was hitting a really rough patch when I went online and found a website, the website of a psychiatric hospital residential treatment program that described borderline personality disorder, and I had never heard of it before. And when I saw it, everything suddenly started to make a whole lot of sense. She went there, and then 4 weeks later, she did something that she had sworn she would never do, and that she hadn't done for a couple of years. She came home. There was still a lot to do, but this was her first step in the direction of recovery. It was also my first step in a parallel journey of change. My husband and I at that time took a class in which we learned what I'm going to take you through. This class was masterfully developed by Alan Fuzeli and by Perry Hoffman, president of National Education Alliance, who you heard earlier today. Alan Fuzeli wrote a book called The High Conflict Couple, fabulous book, talks about relationships in families. And that class that I took then is organized in a 12-week format. It is led by sometimes professionals, most often family members, and it is completely based and founded on the DBT principles of acceptance and mindfulness. In this presentation, you will see a lot of quotes from people who have taken the class. I have since trained to become a family leader, a family class leader, and I have taught, I don't know, over 100 families or so over time. And here is one such quote, and I'm not going to read them to you, I'll let you read it. What is challenging in that class is that the skills that we family members need to learn are both incredibly simple in many ways and very, very hard to implement. Change is hard. And we know how to be parents. And one thing that parents need to hear, especially parents who only have one child who has the symptoms of this illness, is that our parenting styles work with our other children. We're good parents. It's just our parenting style doesn't work with that child who has special needs. So it is really hard to implement, to basically reframe parenting from what we used to do to what we need to do. So the way we do this Well, three things. At any moment in those 12 weeks of classes, they take about 2 hours each, we do one of three things. We either educate, it's sort of like BPDdemystified.com, right? And it's interesting, in 3 years, things have changed a great deal. The landscape has changed. It used to be that 3 years ago when I first started teaching this class, many people just didn't even know the symptoms of borderline, much less the etiology or the various treatment modalities. That has changed enormously, but it presents a different challenge, which is that people's perceptions can be misaligned sometimes. So we, in the education part, we straighten things out a little bit. Skills is central to the class. Not only do we try to teach skills, some of the skills that our relatives learn when they are lucky enough to be in DBT treatment, but we also encourage generalization of skills. So there's a lot of talk about homework, and it's hard because most families who come to those classes come in states of crisis, and in the middle of a crisis with your relative, it's really hard to sort of take a breath and think about the homework that you want to do or have to do. But we encourage that, and we check on it the next class in order to start to effect the change that is so necessary. And then the third aspect is support. And support is absolutely essential because not only do families suddenly start to hear from one another the feelings that they've had all along, the level of invalidation for family members is huge. They hear everything and the opposite. You should be tougher. You should be kinder. You should put her in residential. You should keep her at home. You know, the challenge in making sense out of all of that out there is really, really tough. When people find themselves with people who are going through the same thing, the sense of relief is literally palpable. The support is not just in the first class when everybody meets up. It's also in the next classes when people try out skills and fail, because the first time it's easy to fail, but are proud that they tried and recount that to others. And then other members of the group sort of think, well, wait a second, if she could do this, then maybe I can do it too. And then the first success, which comes usually around class 3 or 4, is like, you know, a common success. Everybody's like rooting for everybody else, and that's when the change starts to take place. So support, very, very important. First module is key. Well, the first module, the first class, it really is everybody meeting up and introducing themselves. But the first module is getting started skills. And the reason why we start with that is because, as I said, most family members are in crisis when they come, and they need something to hang on to. So a lot of the getting started skills have to do with reassurance. You will learn to say no and to not be made to pay for it. We will teach you this. It's okay. You are not responsible for your relative's problems. It's okay that you will get angry at times. Who would not? So there's a lot of reassurance there. But there's also a few first pointers. One of them that is absolutely key is to interpret things in the most benign way possible. We have a really bad word in those classes. We call it the N word, for manipulation. We try to root out a sense that we are being manipulated or that our relatives are trying to manipulate. We try to develop compassion and empathy. Manipulation has very little to do with any of this. So in one of my very first classes, there was a wonderful lady who was in a state of crisis and who was exhausted by her adult daughter's antics, and who came back at the next class after this. And, you know, by most people's standards in the group, maybe she was the most fragile of all of us. But she came back, session 3, and she said, you know, I've been chanting that benign mantra in my mind. I've been saying benign, 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 benign. And it worked. And everybody else in the group was just so joyful to see that just that had given her a little bit of reprieve and release. And everybody else started chanting the benign mantra, and that was very helpful. We introduced the concept of dialectic with the concept of there is not just one or an absolute truth. There can be two of you that are both representative of the truth. And the challenge is not to hang on to our side, but to find a synthesis between the two. So we start to talk about that. And a lot of it seeps in the first session, but a lot of it will come back again in the next modules. The class is not, you learn from A and you end at Z. The class is more of a spiral, and we go over the concepts and the skills again and again from different perspectives, and that's really helpful. And then finally, and that leads into the next module, the last two go together really. Everyone is doing the best that they can in this moment. In other words, the best that they can, the best that your child or your spouse can in that moment may be pretty nasty, it may be pretty bad. But if they could do better, they would. Similarly with relatives, with parents, we are doing the best that we can. And we're here to learn to do better. I should have said, and this is key, and we have to repeat it many times, that the class is really aimed at relieving the relatives' sense of stress and difficulty. We are not taking a class in order to help our relatives get better. It now happens that when people take the class and do well in the class, it ends up having a great deal of positive effects on our relatives. But the key purpose of the class is for relatives. The next module goes into developing interest and curiosity. So we have a bunch of parents who come in who are rightly extremely angry at what is going on. They don't understand it. They're overwhelmed by it. There's a sense of anger, hopelessness, much like I described happened to us, right? The concept of developing empathy, curiosity, is almost the opposite of anger and judgment, right? So we develop this curiosity and this empathy by describing what the illness is, by trying to give a sense of the suffering of our relatives. Now, all of these people, they wouldn't be taking the class if they were not good parents. All of these people really, really love their relatives, and they want to help them, and they want to help themselves. So there is an understanding of the illness that helps them a great, great deal. And then, in order to further the sense of empathy, we expose parents to the concept of sensitivity, reactivity, and return to baseline, which are the hallmarks of severe emotional dysregulation. So people who are extremely sensitive, easily reactive, and take a long time to return to baseline. And then we ask parents or relatives in the family to start to think of themselves in that way. How reactive are you? How sensitive are you? And how quickly do you return to baseline? And oftentimes people are shocked. They're like, oh my gosh, yeah, me too. I have at least two of those three, or I have a little bit of all three. So now the compassion and the empathy starts to be created. We talk a lot about the biosocial environment. We'll talk more later on about how to be validating, but we talk about the fact that families can be deeply invalidating, not that they want to, but when the communication from any member of the family is what we call inaccurate, not representative of their feelings, well then of course the response is going to not match that, and that's invalidating. So we start to talk about that just to expose families to that concept. And then there's a very important and very validating point that we make, which is that the support of families for relatives who are ill is invaluable. That there is research that actually proves that it is better that we family members stay the course and continue to be there in our relatives' lives, even though it's so hard, because it does correlate with a lower rate of rehospitalization. So for all these people who have been told so many times, send her away, put him in boarding school, whatever, there's firm data that oftentimes supplements what they thought and what their intuition was, which is no, keep them here, keep them with me. All the work that we do on that last point, the emotion mindfulness, actually leads into something really important, which is relationship mindfulness. A lot of homework, a lot of role play goes around working on emotion, on relationship mindfulness. And what that involves is, what we're asking parents to do is really, really hard. It is, for people who've never done it before, it's the idea of being completely mindful and aware at all moments of the transactional nature of the relationship, that anything I say will have an effect on you, and anything you respond to me will have an effect on me. And that the dance goes on. And to keep track of that at all times. Not only in terms of content, but also in terms of emotion in the communication. So you can imagine, in times of crisis, that's not happening. But in time, or at least at first. But in times of quiet and peace, it can start. And when it starts, it takes on pretty quickly. But so that's where a lot of the comes in. We then move into, well, we do talk a lot about what our values are as parents. You know, as parents, we have a role, and the role is to teach our kids right from wrong. In order to teach our kids right from wrong, well, we have to know what's right. And so we get very attached to what's right. No, you can't steal. You can't steal. You go give this back, or you go pay for it, and I'll be waiting for you down here, right? I mean, that's what parents do. In this case, we have to change it a little bit. We have to think about whether we want to be right, or whether we want to be effective. There may be different ways of teaching this, and still do our job as parents, but do it in a way that is adapted to these, to those relatives, to our relatives. We move into radical acceptance, and radical acceptance provokes a lot of conversation because it's hard for people to accept that their relative, who often, and I mean it's just evidence-based from the people I've been working with, but oftentimes those children had a lot of promise. And what parents have to accept is that, well, it's not going to look like what we thought it was going to look like. It's going to look different. Accepting is easy when it's pleasant. We call it radical when it's really hard. And it's not hard to accept winning the lotto. It's hard to accept having a sick child. So radical acceptance involves not only saying, okay, here's my child is suffering, or here's my spouse has a hard time. But it involves really embracing it and saying, this is it. This is our life, and it can be a good life. It's leaving any sort of wishful thinking behind. So there's quite a bit of work that goes on about that as well. Limit setting. For people here in the audience who work with families, this is perhaps the one area in which parents need most help. In the end, I mean, there's a lot of work that is involved in trying to understand what every person's limits are. We don't talk about boundaries because we don't want to make it firm. We don't want to say, this is it, and if you cross that boundary, then that's it, I'm not taking care of you. What we need to do as parents or as relatives is understand how far we can go, where we can take it. So I'll give you a quick example. In my first group, where I was a student, there was an elderly woman who had taken a second mortgage on her home to help pay for her daughter's treatment. And I remember thinking, wow, I mean, that's amazing. How dedicated is she? By the time my daughter entered the residential treatment program that I referred to earlier, we had used up her entire college savings account. It was what was left in it. And I thought to myself, if this doesn't work, what do we do? Do I take my son's college account to help pay for her treatment? And you know, my answer was no. I wouldn't. That's my answer. It doesn't mean that there is no right answer or wrong answer. But the idea of coming to grips with your own limits and being told it's okay, being guided to find those limits and being told it's okay is really, really important and helpful. So the concept of, look, I wish I could do more, and it's all I can do, is something that we practice a lot. the end of the class, and we spent at least 2 sessions on validation skills. And the concept of validation, again, many parents have misconceptions about that. They think it's complimenting sometimes, or they think it's just sort of approving. Oh, yeah. And it's not that. Validation means understanding really profoundly what the other person's experience is in that moment and communicating that you understand it. It generally starts with something like, fair enough, or of course you would do this. It doesn't mean you accept. It doesn't mean you even approve. You can say, of course you would do this, considering the situation. So I'll give you a quick example. I had some parents in my class one time who, at the start of the class, expressed a great deal of anxiety because they had not heard from their daughter, who lived independently from them in Boston, who was in treatment in Boston. They lived in Florida, and they hadn't heard from her. And once a week, they had a phone session with her therapist, and then they were on the phone with the therapist and the daughter. And the daughter hadn't shown up at the session, so they were quite worried. Well, next week comes along, and now they're, bordering on panic because they've not heard from their daughter at all in 2 weeks. They've tried to reach people, they've called people in the building, and she seems to be missing in action. So they're thinking about going up to Boston and really thinking through their options there. And the day after that second call, we were all worried. We had to wait a week to find out what happened. But the day after the second meeting, it turns out that they received a phone call from their daughter, who didn't realize how panicked everybody was, and who had chosen to not go to her therapist because a liquor store had opened its doors on the way from her apartment building to the therapist's office. Now, most of us would say, well, couldn't she take another? No, she couldn't. It was the best she could do. The best she could do was to avoid going past that store. She just skipped on therapy. And she forgot to mention it to people. There were all sorts of thoughts and judgments that went through her parents' minds and through our minds as she was doing this. But of course, once we knew what was going on, we could say, well, of course you wouldn't want to go past that store. It makes sense. Good for you. Next time, maybe call us. Let us know, just so we don't worry so much. But it makes sense. That's validation. We talk a lot about the concept of validating an emotion. Emotions are never wrong, they just are. So if you see an emotion, the idea of validating the emotion. I think I've talked about that. So the big picture is that this class, again, is for relatives more than it is for our loved ones. What we try to do is instill the idea that with marginal change, you can block the spiral. Relatives can put a stop to the spiral of envy that often starts and erupts so quickly with the use of these skills. My observation is that, again and again, this is exactly what happens. After 12 weeks of skills, people are capable of interrupting the spiral of anger. I'll give you those final words. I think from my perspective, what is most helpful in this class, what really is magical in this class, is that parents who had so many questions about their ability to be good parents start to see that they can have some level of control, that they can have pride, that they can have hope, that they can be good parents, and that they can validate themselves, that they can say all of this and feel that they can make a difference. And so that's our landscape. It's not the landscape today. It's not the landscape I had expected when our daughter was growing up. It's different. It's a little messy. It's a bit thorny at times, but it's beautiful. It's full of hope. Thank you very much.
Thank you, Nicole. If there would take a question. We would have time for at least one question if someone wrote something down. We can take that. Otherwise, I know that Grace Hall would be very happy to answer questions if you approach her between our sessions. She'll also be here through the day. And I know how to find her, so you can always find her through me. Does anyone have any green cards? All right, we're going to be taking a thank